Neurosurgeons at the University Hospital of the West Indies successfully performed a groundbreaking scoliosis correction surgery in November 2024. Now, this procedure highlights the hospital's growing expertise in complex spinal conditions. And with me to discuss this is consultant neurosurgeon Dr. Peyton Lawrence. Sir, thank you so much for joining us.
Thank you for having me.
Exciting times at the UHWI.
Yeah, it is. I'm glad that you brought up that case. The case isn't so much of a groundbreaking case because they do scoliosis in Jamaica. But it is from the standpoint that we as neurosurgeons at the university spearheaded this case.
Oh, so typically so before this, what would normally happen?
Spine is shared territory between orthopedics and neurosurgery. And the orthopedic surgeons tend to bias towards the scoliosis side of spine surgery. But with the training that we have gotten, overseas, the bandwidth of the neurosurgery department at the university has been expanded, and now we're taking on deformity correction cases at the neurosurgery side.
And this is very significant, of course.
Yes, because what it does is it allows the patients more options to get care. As you know, scoliosis is it can be a debilitating condition, not only from the physical standpoint, but it affects the patient's confidence, their self-image, which has implications in terms of how they perform at school and in life. So the more surgeons that are able to offer the care is the better overall for the population.
Talk to us now about the advancements in spinal care.
Well, so with my training, I am a robotic and MIS, minimally invasive spine surgery surgeon. The university is going towards having things like day surgery in spine, which means that people will be able to come to the university and get surgery and not have to be admitted on the ward, leave on the same day. So that's what we're working towards. Through the initiatives of the CEO, Mr. Fitzmitchell, and the Medical Chief of Staff, Dr. Carl Bruce, they're investing in equipment, advanced equipment such as navigation, which will allow us to do even more complex things and decrease the number of patients who feel like they need to go overseas to get surgery.
And of course, our neurosurgeons are top tier. You would agree with me on that.
Jamaican doctors on a whole are top tier. Anyone who has been overseas can attest to that. We always outperform our overseas counterparts.
All right, so very soon we're going to have a neurospine specialty clinic. Can you just give our viewers a little bit more information about that?
All right, so we've launched a clinic. It already started. It's on Friday mornings at the surgery clinic block at the University Hospital. And right now we're kind of targeting any patient out there who is similar to our groundbreaking case, Ajane Parchment, who may be suffering from scoliosis and afraid of trying to seek help or feel intimidated by the cost of getting care. We would like to attract those patients to come to the clinic because we will be partnering with some surgeons from the University of Miami, and we'll be doing regular missions where they will be coming with their resources to help us get these scoliosis cases done. So we'd like to target anybody who might be having that condition to come in Friday mornings at the University Hospital, because we would like to shortlist a few patients by the end of April.
Okay, so how many patients are you hoping to shortlist?
10.
10.
Yeah.
And it doesn't matter the age of the patient?
No, it can be adult or pediatric.
And how do you go about choosing or selecting that 10?
Well, it depends on the patient's medical and surgical characteristics. So if the patient is fit for surgery from an anesthetic standpoint, that's an inclusion criteria. If the patient has a scoliotic curve that is significant enough to warrant or to justify the risk of the scoliosis surgery, those people will be included. Obviously, one mission can't solve all the demand, but at least we can get started, and whoever doesn't get done, we can continue with the ongoing partnerships.
And when will the surgeries be held? In what month?
In October this year.
In October this year. So is this the first time?
So the Back to Healing initiative it's not the first time. It's the first time they're partnering with neurosurgery. They've partnered before with Bustamante last year for the first time, and they've been all over the world in different parts of Africa. I think they've had over 7 million cases worldwide. So we now are being included from the neurosurgery side of things at university.
That is absolutely amazing. Tell us, what are some of the signs that you need to get surgical help if you do have scoliosis?
Well, basically, one, if you have an issue with the self-image. So the problem with scoliosis is that it causes you to have an obvious deformity when you're standing or when you're walking. And if you have issues with self-image, that's enough. Now, as the curve continues to progress, the patients will tell you that they have trouble breathing, because remember that the spine is connected to the thoracic cage, the rib cage. And if the curve is significant enough, then the amount of air that can go in the lung is reduced. So if they have issues with breathing, also the curve can also compress the spinal cord and end up with problems walking. So if they have evidence of spinal cord compression, so difficulty walking, difficulty breathing, or even just really unhappy with your self-image, you should come to the clinic and we will assess.
So are you seeing more cases of persons with scoliosis?
I don't know if it's more, but we do see patients. Scoliosis is not that common of a condition. I think we might have a backlog of cases that have been neglected. So that's probably where you might have more cases, but it's not that common of a condition, to be honest. Yeah.
All right. Thank you so much, consultant neurosurgeon Dr. Peyton Lawrence, for joining us. After the break, Grammy award-winning singer Dionne Warwick comes to Jamaica for the timeless...